Imagine waking up and discovering that your right hand no longer moves. Your speech sounds strange and your body feels foreign. This terrifying reality is what millions of people around the world face every year when a stroke suddenly strikes. But what exactly happens inside the brain during a stroke, and can it be prevented? To properly understand stroke, we need a brief introduction. The human body, including the brain, is made up of cells. You can think of cells as the building blocks of the body. However, each cell is more complex than a large city, complete with its own infrastructure. Like a city, every cell requires three essential conditions to live and function: a constant, uninterrupted flow of oxygen and nutrients, and means to dispose of waste. In the human body, the bloodstream acts as the transportation system, responsible for delivering oxygen and nutrients to cells while removing waste products. The bloodstream is composed of blood vessels, which come in three main types: arteries, veins, and capillaries. Arteries transport oxygen and nutrient-rich blood from the heart to all parts of the body. When the blood flow is interrupted for a long enough time, the affected organ or part of the organ becomes deprived of oxygen and dies. The medical term for this phenomenon is infarction, which can affect any part of the body, including the brain, heart, bowel, kidney, and even bone. When the affected organ is brain, we refer to it as a stroke. Brain cells, known as neurons, are generally much more complex than other cells and require a significant amount of energy to function. This complexity is why they begin to die only a few minutes after blood flow stops. Once brain cells die, they cannot be replaced, meaning what is lost is essentially lost forever. This is primary reason why stroke is so challenging to treat. A stroke occurs when a blood vessel, in this case a brain artery, cannot transport enough blood to meet the oxygen needs of the part of the brain it supplies. If the interruption is severe enough and lasts long enough, the affected region of the brain may die. Depending on the specific issue with the brain arteries, we can distinguish between two types of stroke. The first and more common type is an ischemic stroke, which occurs when a brain artery becomes occluded. The second, less common type is a hemorrhagic stroke, which happens when a brain artery bursts and begins to leak blood into the brain. There are notable differences between these two types of stroke. Ischemic stroke, being the more prevalent type, occurs when one of the brain arteries gets clogged, most often by a blood clot. This occlusion deprives part of the brain of circulation, leading to cell death. Any region of the brain can be affected, so the signs and symptoms of this type of stroke can vary depending on which part of the brain is damaged. In contrast, hemorrhagic stroke is different. As mentioned, this type occurs when a brain artery bursts and leaks blood into the brain. This frequently results from elevated blood pressure, an aneurysm in the brain artery, or other abnormalities in the blood vessels of the brain. An aneurysm is a sac-like dilation of a brain artery that is prone to bleeding. When bleeding occurs, part of the brain downstream from the damaged artery is left without blood flow, and blood starts to accumulate, forming a hematoma that exerts pressure on adjacent brain areas. This situation is particularly problematic because the brain is enclosed in bone, which cannot expand. This increase in pressure inside the skull can compromise vital functions, such as breathing. Consequently, hemorrhagic stroke generally has a worse prognosis than ischemic stroke. In other words, if two identical individuals are compared, with one experiencing an ischemic stroke and the other hemorrhagic stroke, the person suffering from ischemic stroke is more likely to survive. However, among those who do survive, individuals with hemorrhagic strokes are more likely to make complete or nearly complete their recovery, while those who survive ischemic stroke face a higher probability of experiencing various long-term consequences. In most cases, you can identify someone having a stroke by looking for three key signs: slurred speech, drooping on the one side of the mouth, and weakness or paralysis on one side of the body. The affected person may be unable to walk or even sit, depending on type of stroke, as well as the size and location of the affected area in the brain. There may be various other signs and symptoms. However, these three are by far the most common. Since the brain has no pain receptor, an ischemic stroke is typically painless. In the case of hemorrhagic stroke, there is often a severe headache, confusion, and altered level of consciousness, possibly resulting in a coma. Despite advances in medicine, stroke still carries a poor prognosis. Approximately 1/3 of people affected by stroke will die, and another third will be left with severe disabilities. There are many potential risk factors for stroke, and it is rare for any single factor to be solely responsible. Additionally, there are two types of stroke that occur under different circumstances. However, several significant risk factors can decrease a person's likelihood of experiencing either type of stroke. These include advanced age, a family history of stroke, lifestyle choices, and various medical conditions. The first and more common type of stroke is an ischemic stroke. This occurs when an artery in the brain becomes clogged, most often by a blood clot. Blood clots can develop on top of damaged atherosclerotic plaque in the arteries leading to the brain. They can also form in other parts of the body, detach and travel through the bloodstream to the brain, where they can block one or more of the brain arteries. This typically happens due to issues with the heart, often related to rhythm disorders or structural anomalies. To clarify, atherosclerotic plaque is a buildup of harmful substances, such as certain types of cholesterols, on the walls of blood vessels. Over time, this buildup can harden and calcify, creating a bulge in the blood vessels that can obstruct normal blood flow. This bulge is unstable and may erode, exposing its inner structure to the blood, which can lead to the rapid formation of the blood clot at the site of erosion. This further obstructs blood vessel, especially the artery in the brain. Atherosclerosis is a complex process associated with genetic predisposition and various risk factors. I plan to dedicate an entire video to this topic. The second, less common type of stroke is a hemorrhagic stroke. This occurs when a brain artery bursts, causing blood to leak into the brain. An artery typically bursts due to structural issues with its wall. Common causes include aneurysms in the brain arteries, blood vessel malformations, high blood pressure, trauma, brain tumors, or use of illicit drugs. An aneurysm is a sac-like dilation of a brain arteries that weakens the arterial wall, making it more vulnerable to bleeding. Aneurysms can be associated with specific genetic disorders, atherosclerosis, high blood pressure, infections, smoking, advanced age, and being female. High blood pressure places significant stress on the arterial wall, which can lead to degeneration and dilation. Brain tumors are supplied by low-quality blood vessels that are prone to spontaneous bleeding. The use of certain illicit drugs, such as cocaine and amphetamines, is linked to hemorrhagic strokes, as these substances can cause sudden spike in blood pressure, which may lead to the bursting of brain arteries. Now, let's discuss the risk factors for stroke, which can be categorized into two groups: The first group consists of risk factors beyond our control, including advanced age, gender, family history, and ethnicity. Individuals over the age of 55 have a significantly higher risk of stroke. Men generally face a higher risk of experiencing a stroke, while women often deal with worse outcomes. Additionally, if someone in your family had a stroke or heart attack before the age of 55 for men or 65 for women, you are at higher risk. People of African, South Asian, and Hispanic ethnicities also have an increased risk of stroke. The second group includes risk factors we can influence, such as smoking, drug use, obesity, high blood pressure, diabetes, and elevated levels of bad cholesterol. This group of risk factors is arguably more crucial when considering stroke risk. For instance, a person who does not smoke, maintains a healthy body weight, keeps their blood pressure under control, and does not have diabetes will have a low risk of stroke, regardless of other risk factors. It is well established that smoking causes cancer, but it is less recognized that smoking also accelerates atherosclerosis and is linked to a higher risk of stroke and other cardiovascular diseases, such as heart attacks. Diabetes poses significant dangers because poorly regulated blood sugar levels over a long period can damage blood vessels throughout the body, including those in the brain. This increases the risk of stroke and numerous other cardiovascular diseases. It is important to note that diabetes itself rarely causes death. People with poorly regulated diabetes typically die from cardiovascular complications, such as strokes or heart attacks. High blood pressure adds stress to the walls of the blood vessels, potentially causing structural damage or accelerating atherosclerosis. It predisposes affected individuals to both types of stroke. In the medical community, there is a saying, there is no stroke without high blood pressure. Obesity is another concerning risk factor. It is linked to various hormonal and cardiovascular disorders. Particularly concerning is abdominal obesity, as belly fat is hormonally active, producing or converting hormones that can lead to increased health risks. Treating a stroke is challenging because irreversible brain damage can occur quickly, often within minutes to hours of the onset of symptoms. Therefore, early recognition of symptoms and prompt actions are crucial. The treatment varies depending on the type of stroke. In the case of hemorrhagic stroke, treatment options are limited. Neurosurgeons may sometimes be able to repair leaking blood vessels or use compatible biomaterials to block affected vessels in a procedure called embolization. More often, treatment focuses on supportive care to stabilize vital functions with the hope of achieving the best possible outcome. In the case of ischemic stroke, treatment options include dissolving blood clots that obstruct brain arteries using special medications or mechanically removing the clot with specialized tools. Both methods are effective if applied within a few hours of symptom onset. As the time passes without blood flow to the affected vessels, the area of irreversible brain damage increases. If early treatment is not feasible, supportive care remains the only option. After a stroke, most individuals experience some level of residual damage, which can range from minimal to severe. In these cases, physiotherapy is crucial for maximizing functional recovery, improving independence, and preventing complications. The long-term consequences of a stroke can vary significantly based on the location and size of the brain damage and may include speech impairments that can range from mild difficulties to complete mutism, where the affected individual cannot speak at all. There are two major areas in the brain associated with speech. One controls motor function and the other is responsible for understanding language. Damage during a stroke may affect either one or both areas. As a result, some individuals may understand spoken language but be unable to speak, while others might speak incoherently but struggle with comprehension. If throat muscles are affected, individuals may have trouble swallowing liquids and solids, leading to complications such as aspiration pneumonia or malnutrition. Stroke can affect urinary and bowel control, resulting in an incontinence or retention. A common long-term consequence of stroke is weakness or paralysis on the one side of the body. This weakness can range from subtle impairments to complete paralysis, leaving the person unable to walk or even sit. Many individuals experience gait and balance issues, which increases the risk of falls. Bedridden individuals require a high level of care to prevent complications like bedsore, dehydration, and infections. Over time, affected limbs may become spastic, leading to increased muscle tone, stiffness, and deformities. Stroke survivors may face psychological challenges such as depression, anxiety disorders, emotional instability, and social withdrawal. While nearly all stroke survivors experience some memory issues, about 1 in 4 may develop post-stroke dementia. Some individuals may also experience post-stroke epilepsy, characterized by various types of seizures. In specific cases, depending on the stroke's location, chronic pain syndromes may occur, where the pain in a particular body part correlates with damage in a specific brain region. The economic and social repercussions of a stroke can be significant. Many individuals are left with some degree of disability, making it difficult to return to work, and they often require assistance with daily activities, which can lead to a loss of personal autonomy. Family members frequently become primary caregivers, which can result in frustration, depression, and diminished self-esteem. This combined with reduced mobility, speech issues, and cognitive impairments may lead to a social isolation. Additionally, stroke can alter personality and affect emotional regulation, resulting in interpersonal conflicts. Caring for stroke victims can be costly as they often need expensive ongoing support and rehabilitation services. It is essential to acknowledge the impact of stroke on caregivers, who may experience physical, emotional, and financial exhaustion. Caregivers often struggle to find time for social activities and self-care, leading to a reduced quality of life. Prevention is crucial given the limited treatment options and serious long-term consequences of stroke. Notably, individuals who have experienced a stroke are at significantly higher risk for subsequent strokes. There are two types of stroke prevention, primary and secondary. The goal of primary prevention is to prevent a stroke from occurring in the first place. This can be achieved by addressing risk factors such as obesity, high blood pressure, diabetes, and issues related to the heart or blood vessels that lead to the brain. On the other hand, secondary prevention aims to prevent recurrent strokes in individuals who have already experienced one. This is typically accomplished through the use of blood-thinning medications and by managing the risk factors associated with strokes. For many stroke survivors, life is never the same. Some lose their ability to speak, others struggle to walk, and many depend on family members for the simplest daily tasks. But here's the truth. Stroke is not always inevitable. By knowing the risk factors, by controlling things like blood pressure, diabetes, and smoking, we can dramatically lower the chances of it happening. And if a stroke does strike, recognizing the warning signs and acting fast can save a life and sometimes even allow for a full recovery. Knowledge is power, and in the case of stroke, that knowledge could one day save your own life or the life of someone you love. Thanks for watching. If you found this video helpful, consider subscribing for more educational content. Have a great day.